What city are you in?
Well, I live in Philadelphia, but today I'm in Detroit.
Ah,
Looks like we're live.
okay. Are we live?
We are.
Sounds good. So I'm Dan Monroe, and welcome to today's TEDMED Great Challenge, where we're going to be talking at length and extensively with a great panel on the topic of mobile health. TEDMED Great Challenges are sponsored by the Robert Wood Johnson Foundation, and are designed to go into detail and depth around topics that don't have, in effect, a magic bullet in terms of a solution. And a lot of health, as we know today, it winds up that way. And we will be taking questions via social media, so please feel free to submit those, and we'll try and get to them as best as we can. So the panel today is a stellar panel for the topic of mobile health. And I'll start just with introductions, starting on the left, which is Anjana Rajan with the Janssen Healthcare Innovation, big wave from Detroit. And then next to her is Bianca Frogner, George Washington University School of Public Health and Health Services, where she is an assistant professor. I'm Dan Monroe, next up, and I write in the healthcare space under a number of banners, but most typically under the Forbes banner. And next we have Doug Nagley, who is a founder for Infield Health, a startup in the mobile health space, so very much front and center for the mHealth discussion. And next to Doug is Jackie McCarthy as a director of CTIA, the wireless industry, global industry monitor and forum. And then next to Jackie is Stacy Chang with IDEO as a director of their health and wellness practice. So welcome to everybody. And Jackie, I'm going to start the questioning with you. If you can hear, can you hear okay?
I can. Can you hear me?
Yes, we can, and that's great. So the question comes up pretty quickly in light of all of the recent activity by the FDA, and especially in light of their announcement last week, which is, I think, literally a week ago. Can you give us a kind of a brief summary of what the FDA announced?
Sure. So just to provide some background, the FDA regulates medical devices, and those can be as simple as a tongue depressor or a thermometer, or as complex as robotic surgery devices. And they take a risk-based approach to medical devices and basically have three categories of regulation. Class 1 for sort of low-risk devices like dental floss, Class 2 for kind of more mid-range devices like infusion pumps, and then Class 3, which requires pretty extensive controls and pre-market approvals for devices like pacemakers and defibrillators. But for some time now, there's been some confusion as to how the FDA would treat apps that either provide information about health-related or wellness-related issues, or that relate to the treatment or diagnosis of disease. And the FDA issued draft guidance back in 2011, providing some categories and some approaches, but there was a real lack of certainty in the marketplace. That was clarified pretty significantly recently with the FDA's release of final guidance on mobile medical apps, and that was released on September 23rd. And just to walk through the general approach and then kind of the specifics of that, the FDA decided that it would rely on the functionality of the device, not the platform. So it really doesn't matter whether the platform is the smartphone, a tablet, a laptop, or a desktop. They're looking at what the function of the application does and whether that function makes the application akin to a medical device. And so the FDA basically provided for 3 categories of treatment of applications. The first one, which is kind of the broadest category, are mobile apps which are not considered to be medical devices. Those include things like medical flashcards, libraries of clinical descriptions, games that simulate scenarios to train like CPR professionals, maybe mapping apps that provide the closest medical facilities, or apps that help patients manage or track medical claims and bills. That's kind of the broadest category. The second category are apps that are considered to be low risk and that the FDA will use its enforcement discretion to basically not require any sort of regulatory approval. And those are a pretty broad category that include things like tracking of health info, things like steps taken or calories consumed. Also apps that would help coach patients with a lot of the chronic conditions that so many in the U.S. and around the world are facing, things like cardiovascular disease, diabetes, or obesity. Also apps that provide some sort of video conferencing specifically intended for medical use are in this category. And then the third category is really what the FDA means by the term mobile medical apps, is the really small category of apps that basically meet the definition of a medical device under traditional FDA regulation and that are either used as accessory to a traditional medical device or actually turn the mobile platform into a regulated medical device. The FDA has reported that as of last year, they had seen less than 20 of these in the marketplace. So this is a pretty small sector, at least as of now. And these include things like sensors or leads on an app that measure and display eye movements or EKG. These are, for example, also apps that provide test tones, hearing evaluations, or apps that use the smartphone's accelerometer to measure the degree of tremor. And so these really functionally turn the smartphone or the tablet into a regulated medical device. And again, this is a pretty specific category. And so the FDA, I think, by providing this, gave a lot of certainty to the marketplace that is certainly growing not only for wellness and kind of health maintenance related apps, but also for more cool or more complex apps.
Interesting. So, and Jana, you were, as a part of the Janssen Healthcare Innovation, what was your reaction when you saw the FDA announcement?
So first, thanks so much for having me. So yeah, I'm with Janssen Healthcare Innovation, and for those who don't know, we're the startup organization in Johnson & Johnson that's focused on integrated care solutions. So one of our areas of focus is, of course, mobile health. And so we've built a mobile adherence app called Care for Today Mobile Health Manager. So about a year and a half ago, we launched version 1.0 of this app, and that was primarily focused on medication appointment reminders. And recently we launched version 2.0, which has a lot of enhanced features. So now we're focusing on adding behavior incentivization through a feature called Care for Charity, in which we make a charitable contribution in your name every time you successfully adhere to your medications. We've also added a caregiver engagement feature called Care for Family, which enables loved ones to monitor and ensure that your patient is taking their meds. And we've also expanded our analytics and reporting capabilities. So we were definitely monitoring the FDA guidelines over the past year and a half, but in the meantime, while we were waiting for the change to come, we made sure we were registered as a 510(k) device and were HIPAA compliant. Interestingly enough, the guidelines actually launched the same week that we launched version 2.0, and there's a lot that's covered in there, and I think Jackie did a great job of summarizing a lot of these changes. The area that applied to us was around applications that provide medication reminders. And based on how Jackie explained it, the guidelines say that the FDA is only going to intend to exercise enforcement over the devices that are medical device applications. So it means that it won't be enforcing these requirements for Care for Today.
Awesome. And Bianca, how do we get to the point where we know with any kind of sort of certainty or imprimatur that a calorie tracking app is really evidence based and is clinically valuable as opposed to simply being casually useful.
So there's been some strides in creating and accumulating evidence in the mobile health space. Johns Hopkins recently launched something called mHealth Evidence, where they've pulled together the literature, gray and peer-reviewed literature that provides easy access to evidence around various mobile applications. And you can search in the literature too, and to find some lit reviews where or some evaluations that have been done around apps. However, one of the biggest challenges is that mobile health technologies are constantly changing. So as soon as this evidence is collected, there's a high likelihood that the app is probably already out of date, and that's a challenge that we still haven't yet found a way to solve.
Interesting. So Doug, here's a question that just came in fact, probably pretty well targeted for you on Twitter. How can we keep health tech's longer R&D cycles from creating prohibitive market prices? I mean, you're in the middle of this with what you're developing. How do we do that?
I'm sorry, I don't exactly understand the question.
Well, given the new regulations, what's the impact in the sense of R&D development and then also R&D cost?
Right. Thanks. And thanks for having me today. I think in R&D development, it's interesting if you talk to the sort of nimble innovator people in this space. A lot of their R&D and development is really going out and testing with users. And so it's really finding things that resonate and finding things that either provide value back to providers and payers and/or provide behavior change and outcomes basis. And so those nuts that the innovators are trying to crack either on the cost and revenue side, inside the provider payer, or on the behavior change, that sort of flies outside of that area of cost of innovation. I mean, certainly FDA regulations and other regulations are hovering, but if you talk to the really nimble teams in innovation, they are really screaming ahead, and they're really trying to optimize whatever small, I mean, everything in healthcare is big, so even the smallest thing is big, whatever they've carved out for themselves. So I'm not really sure that is entirely on the mind of the guys that are making stuff. And women too, forgive me.
And that is the challenge. So, Stacy, you're at the forefront of this with a lot of companies that you're in a position to help or mentor with. What are your thoughts? What are you seeing relative to this important category?
A few things, actually. I think the preponderance of apps that we've seen come out in the preceding few years have been focused on either replicating simple medical devices that already exist, heart rate monitors, pulse trackers, things like that, or a lot of the quantified self, data tracking, Fitbits, things like that, and that's all fine and well. But I think I was starting to see a wave of apps focused on actually making the best use of the medium. So you're seeing folks take old school med tech, very basic, heart rate monitors, and actually using them, and then the medium of the mobile phone to actually allow untrained lay people to actually deliver medical care in scenarios where there typically isn't care available, or using the medium to actually realize this promise of population health management, right? So allowing patients to use very small, finite inputs to create a panel of data that then healthcare professionals can monitor and look for exceptions, so they can actually keep patients from, sort of going off the guardrails and ending up with an exacerbation of a disease or something like that. So I think the promise of the medium now is actually starting to be realized, as opposed to just a place or a venue to replicate what already exists in the physical world.
Just out of curiosity, will you be planning to attend the mHealth Summit in DC? I think it's next month.
I will be, actually. Actually, we're running a workshop there.
All right. So that's a fair plug. So, Jackie, you have much more of a global view from the vantage point of CTIA. How would you categorize the U.S. relative to what you're seeing necessarily in other countries?
Great question. I think I think we're certainly the birthplace of the app, and the companies that run the most well-known app storefronts are companies like Apple and Google, but I think that and I know that there's a concern about, and you would, I think, addressed it in one of your previous questions, that kind of the long lead time of the FDA relative to its counterparts and others might stifle innovation, especially when it comes to using that platform for health. But I mean, I see from the technological side and also from the investor and VC community a lot of interest, and I think especially with the clarity that the FDA has given us with these guidance documents, it really provides everyone in the sector with a good path forward. But I do think that especially with countries with advanced health infrastructure, maybe that have already addressed some of the payment issues that and reimbursement issues that we're currently grappling with on a really on a national scale, that those areas are really ones to watch, and we'll continue to use this platform in innovative ways as well.
Awesome. Anjana, you're in charge relative to what you see with Janssen. They run a lot of healthcare innovation challenges. Are those an effective mechanism for sort of incubating the next generation of mobile healthcare apps?
I think so. So before I came to Johnson & Johnson, I too came from the startup world. So I definitely understand and empathize with a lot of the challenges that entrepreneurs are facing by themselves. And that's why at JHI, we're very passionate about not just building our own businesses, but connecting with the external community and the venture capital community around us. So our team is actually based in 3 locations. We're on the West Coast, the East Coast, and in Europe. So we make a big effort to meet face-to-face with different entrepreneurs, with different academics, VCs, and the accelerator programs in all of these different regions. JHI has also led quite a few innovation challenges where we're able to provide no strings attached seed funding to startups who are building their first prototypes. So we think it's a great way to be collaborative. We're excited to share our knowledge, but we're also excited to learn from others.
I'll toss the same question right back to you as well. Given that you have a global footprint, how would you rank or how would you rate what Americans, I mean, we're leading in a lot of categories in the sense of app development, but are we behind in the category of mobile health?
I think right now we're actually building different integrated care businesses in both the US and in Europe. I think fundamentally the healthcare challenges are the same, which is we're trying to improve patient outcomes in a cost-effective way. Pertaining to mobile, I can speak just briefly about what we've seen here in the US and what we've seen in the UK. One of the things we need to take into account is the infrastructure. So from a mobile infrastructure perspective, I think those are challenges from a design perspective that we have in Europe, which changes the way we build native apps versus mobile optimized sites, for example. I think SMS providers are different in these different countries as well. So I think from a technical perspective, there's obviously different design and infrastructure issues, but from a holistic perspective, I think we've seen thematically a lot of the same drive to be innovative.
Can I chime in on challenges for a second?
Absolutely.
So I think what's really been fantastic about sort of the last 12 months in challenges, so if you think about 2 or 3 years ago, a lot of the first challenges came out on challenge.gov, and they were different parts of the federal government sort of getting the word out about health innovation. And that's a good thing for them to do. They sit on tons of health data. Obviously, they administer a lot of health care. And they have a very loud microphone and megaphone to convene. I think what's really been great about the last 12 months is really seeing private industry launching their own challenges. And private industry coming to the innovation community and saying, hey, we have this specific problem. And so instead of a general health problem, which applies to lots of people, we are company, and Janssen in particular, we are company X and we have this problem. Who can come help us? is I think you have a lot of health innovator people that are sort of on the sidelines or in the game, and their stuff can work for lots of different things. And to some degree, they encourage having industry come to them and saying, we have a problem in diabetes, or we have a problem in pediatrics, or we have a problem in surgery. You know, how can you help us do that? It's really provided a lot of guidance to the innovation community. Not to mention the promise that there's a customer there too, which is quite helpful.
The follow-on question to that, which I'll toss to Stacy, and then I'll come back to Bianca. But Stacy, within IDEO, is there any conscious activity with any of the major healthcare innovation centers that are often spun out or spun up inside hospitals or large institutions? I'm thinking in particular of Intermountain recently opened one. Cleveland Clinic has an innovation center. Kaiser, of course, I think probably pioneered that early on in Oakland. But a lot of these institutions now, large healthcare facilities, are incubating an innovation center in their own right. Is that work that IDEO would be integrated with?
Interestingly, we've been responsible for a number of those, actually many of the ones you actually mentioned. So we've partnered with these healthcare organizations to actually establish their own capabilities and their own offer in developing innovation internally to their organization. And that's fantastic. And the most successful ones have gone on and turned those into institutions of their own, right? Have taken a process and made it their own, made it match their own cultural nuances and their own needs. But I have to say, you know, the ones that are contained within the institutions suffer a little bit from an insular point of view, right? Because they're focused on the issues that are most prevalent in their own organizations. And I think there is value to innovation centers that draw from a broader spectrum of contributors. And so, you know, I'd encourage maybe publicly here, but you know, I certainly do privately, for those folks to actually look outside their own four walls and see where they can collaborate. You know, the classic dilemma of the healthcare system is that people spend a lot of time trying to optimize within their own fiefdoms. They do much better actually working in alignment with other stakeholders. You know, there's no shortage of large consumer electronics companies, for example, who want to take their war chest and invest that in healthcare. The problem is they don't know a whole lot about healthcare, and one of the roles that these innovation centers, you know, Kaiser, Cleveland, Mayo, any of these folks can do is actually to draw some of those partners in to help them achieve things that'll be mutually beneficial for everyone.
And Dan, could I add to that from
Absolutely.
an academic point of view?
Absolutely.
So, as someone who has studied the healthcare delivery system, I recognize that I'm limited in my capacity to actually do something on the ground to make immediate change, and that's where partnering with entrepreneurs would be ideal. I know here at GW I've been trying to promote the idea of building an incubator where here at the university we can help entrepreneurs break into the healthcare arena. Now, incubators have often been partnered with academic sites around the nation and have been quite successful at spinning out new technologies of various kinds. But we should do more of this in the healthcare sector in particular, because the healthcare system is very complex, and I do think that sometimes outside thinking from folks on the ground can probably find some of these innovations that us academics can't quite find yet, but yet we can help guide people to understand the system. But the one of the challenges is when I talk to entrepreneurs in the area and ask them why they don't innovate more in the healthcare delivery side, so not just the personal health side, but the delivery side of healthcare, they tell me that there's a lot of regulation, it's so complex, so it's a little hard for them to understand how to break in, how to figure out where they can help, and where to make money.
If I can, I'll add to that, just to ping pong back and forth, just building on Bianca's thoughts. You know, the large academic institutions have a role to play, a really significant one, and not the least of which is they have access to all the healthcare delivery sort of protocols and capability to prototype and experiment and things like that. They also have a great understanding of what it takes to take, you know, classic benchtop research and see it into the clinical space. You know, so the notion of translational research, you know, I work pretty closely with UCSF here. You know, they've developed some really interesting programs to actually help entrepreneurs understand the space, understand what it takes to actually take a novel idea and then shepherd it through all the regulation and the challenges that are in the healthcare space. I actually think that's one of the big hurdles to healthcare innovation is that, you know, the the complexity of the space makes it really difficult for entrepreneurs to realize their ideas quickly. You know, in the consumer space, it's easy. You go launch an app on the App Store, right? And you know, the only person who says anything about whether that can or cannot exist is Apple or Android or whoever, right? But you know, on the healthcare side, you've got to interpret what the FDA just said about mobile apps. You've got to concern yourself about HIPAA and security regulations and all that sort of thing, which really makes entrepreneurial innovation difficult. And I think the responsibility of some of the institutional stakeholders, I don't mean just academic institutions, but the folks who are actively involved in that space, is actually to make that path a little easier for those entrepreneurs who want to participate.
And Bianca, as a follow-up to that, I did want to ask, in part because of the difference between sort of the public health category of mobile health, is there a dichotomy there between public health and what we're seeing in the way of mobile health? Are those two worlds miles apart, or are they coming together from what you're saying?
No, I would say, if anything, actually, I believe that there's a lot of promise in the mobile health space to actually help bring together public health with the healthcare delivery system. You know, the Affordable Care Act's goal is to really promote more primary care, not just increase access to care, which has been the focus, especially in the media, is to improve insurance access. But another big goal of the ACA is to promote primary care. But a lot of doctors are just not, they don't have enough time to provide all the preventive care they need to do. They don't have all the resources they need to manage health, chronic diseases. And mobile health can help bridge that gap, because it allows individuals to take their own health into their own hands. But we need to help these different mobile health devices to connect back to the doctor's office. We need to help mobile apps connect back to electronic health record systems so that doctors can actually really use this information in a meaningful way. So if anything, I think that it is going to help bridge the gap, but we definitely have some technicalities we have to work through first.
Yeah. Anjana, is this...
Can I add something on that too?
Yeah, okay, Doug.
Real quick, I'll say that academic centers also have a very interesting thing in that, you know, of course, you know, they're places where a lot of people bounce around a lot of ideas. You have younger people that are interested in doing research and collecting data. Some of it is for school projects. But of course, they also operate hospitals. And I think a lot of times the innovator community, you have a couple of innovator people come up with a new piece of software or a new piece of doing something. And one of the hardest things, other than regulation, is actually getting a population to test it on. Because unlike consumer apps where you can get your 50 buddies to use something, in their spare time, you know, in healthcare you have to have actual hospital patients. And you can't just, you know, get hospital patients here and there. And academic medical centers have hospital patients. You walk across the street and there's a hospital there. And it's a really helpful way to test things. You get data and research from the academic side, and you get patients from the medical side. We've done that with VCU Medical Center in Richmond. We tested a new piece of technology, and someone did a PhD dissertation from it and published it last week. And we had access to patients in the hospital. So it's really helpful for the innovator community, too.
Yeah, and I'm going to ask a question for the panel one at a time, but it's the same question in effect. And John, I'll start with you. Are you seeing support from major vendors like Apple and Google relative to helping a proliferation of mobile health apps? Is that a direct connection, and should it be?
I think when you look at companies like Apple and Google, I think the best way to see their role in healthcare is looking back 5 years ago when the mobile app economy first emerged. When we first looked at this economy back in 2008, it started out as a highly regulated, very closed environment, and that actually spawned the jailbroken market, and it's what caused Google to position itself as a champion of open source. I think we've come such a long way since then, when the mobile app economy first emerged, and we're seeing that they're really not playing a hindrance in this at all. It's really up to the application developer themselves and the entrepreneur to really decide how they want to use these platforms in healthcare. I think we're seeing a lot of really great native features on these platforms that are enabling for medical mobile apps, such as location and things like that. But I don't think that they have been a hindrance in this at all. And I think we're going to be seeing just an even greater surge as we move forward, as different interfaces and technologies continue to grow.
Bianca, is that even an issue relative to anything you
I mean, I agree with a lot of what Anjana is saying in terms of the open source aspect that these big companies could assist with, because I think a lot of innovators, in order to make real change in the healthcare industry, need a little bit more openness and transparency in the data that's being collected. And it's not just about Google and Apple, but that means also these big electronic health record systems like Epic that really probably need to start opening up their data so that more people can start innovating around that information. On top of that, I think we also have a big searching problem to find the right apps out there that might work or might not work. There is a company called Quixie who's trying to create a better app search engine. However, that doesn't help one who's unfamiliar with the health space to actually find the apps that they want. You can ask a question and it queries certain topics, but it's not like going to the Kelley Blue Book where you're trying to buy a car, where you're trying to identify different categories of health apps and then find the app that you want. It's a different function that doesn't currently exist out there in the market.
Doug, are you Apple or Android based, or does that make a difference?
We're both. We work on Apple, Android, and also on SMS text, so we sort of cover all the bases. There have been some large technology organizations that are helpful, and they usually work through some of the incubators. So we're in an incubator called 1776 in DC, and Apple, Amazon, AWS has been very helpful, as well as Microsoft has been quite helpful with back-end technology resources and things like that. And I know that Startup Health and Blueprint and those other guys are tied in as well with some of the large IT providers.
Stacy?
Yeah, actually, I'll build on what Anjana was saying. The folks like Android and Apple are certainly not a hindrance, but I actually think they could play a role in greater enablement. So one of the things that we're constantly coming up against, especially as people are trying to develop mobile apps in the hospital workflow in particular, right, is the need for secure transmission and HIPAA compliance and all that kind of stuff, and they're struggling with that, right? I would love to see Google or Apple or somebody develop a platform that allows for that kind of communication to happen, so that the people can actually get on with the functionality as opposed to just the sort of detritus of being in the space.
Yeah, just to build off of what Stacy and the group were saying, I think where we really could see more openness, and Bianca was completely right, is where these healthcare systems in the hospitals reside, because that's ultimately where a lot of the challenges in healthcare sit, but the patients aren't in the hospital all the time. So how do we create integrated care delivery, not just in the hospital, but throughout their lives? And so I think we're seeing, when we talk about integrated care delivery, it's about bringing the relevant hospital data and bring it to the patient when they're at the pharmacy, at the grocery store, at the gym, and so forth, to really then drive the right patient outcomes. So I think we're seeing some progress in that space. I know Epic just opened up an open API that's moving in absolutely the right direction. I think the HL7 protocols are becoming a little bit more mainstream for us to understand and integrate with existing legacy systems. But I think we've learned, through our experience at JHI, that it's an uphill battle for everyone in this space, not just the small companies, and we're all trying to figure out how do we, make progress in the right direction.
So here's a question from Twitter, and I'll try and ask it just the way it was phrased. What should healthcare stakeholders do to ensure that FDA is not a disruptor, but rather a guard for disruptive innovation? It's a bit open-ended, but are there things that sort of legacy healthcare stakeholders can do to help the FDA in their role? Stacy, you want to start?
Sure, I think that's an interesting. So if the question is what can legacy healthcare stakeholders do, I mean, by virtue of size and impact and scale, I think they could actually take the lead on some of. So let me roll back for a second. Jack can get a nice job of sort of reviewing sort of the FDA guidance. But one of the things that it still leaves open is a group of apps where they talk about sort of there's room for enforcement, called enforcement discretion, I think it is, where they sort of reserve the right to decide whether or not they're going to enforce medical device rules now or later. And that still creates a little bit of uncertainty, right? And I think the reason the FDA did that, kudos to them, is because they're trying to still see how that will emerge over time and get enough data to see whether that's actually something that need to regulate really represents either safety or efficacy issues in the marketplace. And so to return to your question then, I think the large-scale healthcare stakeholders have a role in actually establishing proof data, proof models that those apps that the FDA is still unsure about are actually safe and useful, right? And so they can step in and sort of provide the initial experiments and prototypes that prove that there's room to play there, that the FDA need not be too worried, and then hopefully to open up the space.
Doug, anything from your vantage point?
Well, I think from the innovator community, you know, when innovators come up with new solutions and they bring them to the marketplace, of course, eventually they're going to face competition, either from copycat people or maybe people that were there before that they are frankly copying. And to the extent that you have to be safe and effective because you have FDA, you know, in the background or right next door, I think it's a good thing. I think it forces the innovator communities to come up with real 1.0 solutions, real things to try. And to be quite honest, if you're on the varsity team in the innovator community and you're making really good stuff, it's kind of nice to know that the FDA is there to make sure that the people that are JV that are not making very good stuff aren't going to be able to go all the way up the ladder. So, I mean, I think the FDA is spot on with what they're doing.
And could I add to that, that I think one of the challenges that I see FDA dealing with is, although Jackie said there's only about 20 or so applications that are coming, I mean, clearly that's going to be a rising number. And I think over time, this space is going to explode more than where it is now. I mean, there's about 100,000 health and wellness apps out there. And there will be more, and some more that are going to fall into this area of health devices, I'm sure, as technology improves. So I think that what would be helpful is if someone out in one of these stakeholders, if they're willing to kind of help FDA develop some sort of a check function, something that's more automatic that can help either sort through all of these apps to help find the ones that actually really need regulations and the ones that don't. And that actually would help app developers understand kind of where their apps sit in this sphere. And while that might maybe scare off some app developers because maybe they want to avoid falling under FDA regulation, which I've heard anecdotally is happening, this might encourage other innovative ways to deal with health in ways that we can't quite imagine yet. I don't think it could hurt anyways.
Anjana, is that similar to what you're saying?
Yeah, I mean, I actually think what would make sense is if collaboratively we understand how to build these guidelines together. I think app developers should be helping shape the guidelines because they understand what it takes to build it. And conversely, I think they need to view, and app developers, we need to be better about looking at these regulations not as a hindrance, but embracing them as design principles. So putting patient care at the forefront of our product development and making sure that we're collaborating with the regulators and understanding how to build good things and not viewing it as an either or.
Yeah.
Got it. So I'll ask a question in between the Twitter questions, which we'll get to, but a key element of this is payment models. And have we gotten to a point yet where the payment models are matched with the applications in a way that there is revenue through these opportunities? Stacy?
That's interesting. Are there payment models? I think we saw a question come through earlier we haven't responded to yet about whether or not your doctor's actually prescribing apps. I think until we actually align the reimbursement models, I'd love for ICD, 10.5? to include mobile apps as a reimbursable mechanism, you know. So I think until we see that happen, it's going to be more challenging. You know, the value chain is going to have to, you know, for the time being, skips the traditional medical system in terms of reimbursement, and so the alternate models are going to have to evolve over time.
Can I add to that? So Medicare has started to add reimbursement codes for telehealth, and they are starting to have codes for preventive services. Now, the payment values behind that have not been created yet, so there isn't that payment part yet. And I think part of it is that we haven't quite identified what that dollar value should be because there isn't enough evidence out there on these apps. There's just so many of them. There isn't a really fast way to keep up with the technology. We need new methodologies and new ways to evaluate these apps so that we can get that value information to insurers so they can find ways to start paying for this. Because I agree, I mean, you need to start paying for preventive services in order to get doctors to do this.
Yeah, just one anecdote to add to that, Bianca, is one thing I've heard from multiple stakeholders. It's one thing to have the reimbursement codes; it's another thing to actually get the reimbursement.
Yes, right.
Right, getting it all the way through the cycle. Doug, you're really in the forefront of this but you're more on the enterprise side, so your solution, I imagine, sells directly to large provider installations that maybe have a budget in the enterprise software space to accommodate this. Do they pay directly?
Well, we work off a shared savings model, so we actually approach providers, and our revenue comes from the money either they save by using our stuff or additional revenue they generate from patient engagement. So there's that. I want to also just make sure I make a point about reimbursement. Is there's a lot of ways to sort of fund mobile health or telehealth that isn't pay X for mobile health action, right? So readmissions is a really good example. There's a number of innovations in readmission that providers are using to reduce readmission, and they're not putting a code on the actual action to get reimbursed $12 for a telehealth visit, let's just say. But of course, when you reduce readmission, you avoid the Medicare readmission penalty. So there's a lot of different ways to get paid that aren't necessarily just writing a code for a mobile health thing. And I suspect that's the way we're going, especially with ACOs coming online, where anything that reduces cost for ACO is in essence, just like $1 in revenue. So I think about that too.
Ancha?
Yeah, and I think that's the existential question, which is how do we monetize a patient-centric healthcare system? And I think, at least the way we view it at JHI, is that while we want to be building patient-centric care, we have to understand all the different stakeholders who are ultimately paying for it. And those are the employers, the payers, and the hospital systems. So my advice to up-and-coming companies that want to be in this space is don't just view healthcare simplistically as a direct-to-consumer business, but understand that you're doing a hybrid of enterprise and consumer. And I think that's at least the way I think of it, is how do you build a consumer-centric product that works in an enterprise model?
I have an idea around that, but I won't. I'll share it because it's part of an article that I wrote, where the article was the ROI of an iPad in a hospital setting was 9 days. And it sort of begs the question in my mind is, what's the ROI of a smartphone, any smartphone, with a data plan in the hands of a chronically ill patient? And shouldn't we know that? But that's sort of a separate personal question. Relative to smartphones and these consumer apps, are we seeing the kinds of apps that are changing consumer behavior? Because that seems to be a key element as it relates to preventativeness and wellness for the consumer app itself. Bianca?
I think that changing individual behavior has been a challenge for a long time, with or without technology. I mean, I think one of the concerns right now is that maybe some of the people using things like Fitbits or MyFitnessPal apps are those who are already motivated to be healthy. And so I think the biggest challenge is trying to figure out how do you get those who are not so interested in their health, or who are not as motivated to work with their health, to get them into this space. But I can see that if technologies are particularly passive, people are more likely to adopt it. So if they don't have to do much work to actually monitor their health, we might get more people on board.
Yeah, and that's my favorite quote from Sunny Vu, which is that wearable technology has to be either invisible or gorgeous.
That's right.
That's right. I love that approach. So Stacy, coming back to you on the same question, mobile health apps.
Yeah, I mean, the question I think is almost always about feedback loops. Like, we spend a lot of time thinking about adherence, not just from a medication point of view, but about adherence to therapy or adherence to anything in general, right? For the disease states like, CHF or COPD or anywhere where your divergence from a strict therapy creates a really quick feedback loop in terms of feeling bad, the challenge of keeping people adherent to a mobile protocol, not so much of an issue. But for the things like hypertension or other diseases where essentially you get no feedback whether you're on therapy or not, we've got to create surrogates for feedback, things that, and we've seen that in game mechanics using social mechanisms and gamesmanship and things like that. But I think there are other ways that we could actually develop ways to encourage people to engage in a way that's more than just, what's my blood pressure measurement for the day, 140/90. Those things are fractions, right? Most people don't really care about that math. It's just a number. But if you can create a mechanism that actually is more meaningful to them and then actually incurs a type of interest that goes beyond just measuring a number, then I think you'll begin to see sort of the behavior change we're looking for.
Actually, I think that, or can I just mention, I think that actually health games is a real area for a lot of innovation to get people more engaged too, which is happening in the app space.
Jackie,
And
I'm going to try one more time. Are you there?
Yes, I am. Yes, I'm here.
So help me understand globally from a larger footprint. Are other countries able to monetize mobile healthcare apps better than we are, faster, quicker? Is that happening in other parts of the world?
I think there are certainly small examples of it, especially where, again, to others' point, the payment systems and insurance reimbursement systems are a lot more well settled and also more inclusive of things like preventative care. I think we have right now almost an embarrassment of riches when it comes to the number of wellness and health apps out there, but I think that our marketplace needs to catch up in terms of clarity of reimbursement and licensure issues to really scale this to something that goes beyond the early adopters to more of an acceptance by the general population.
Yeah. Doug, your app, as you said, is based on a shared savings model. Is that primarily around readmission for right now? Is that the entry point that you're seeing as the most successful?
Well, frankly, what Medicare did with readmission was really open up a fantastic experiment for innovators to come in with a very clearly defined problem with really clearly defined data points, and short ones too. You start a readmission program, and theoretically on day 31, you're getting information on whether people are readmitting within 30 days. And the fact that they put a real dollar penalty on it drives providers and ACOs to take a look at it. The readmission, I think, has been a really interesting example. I think it's going to be interesting looking forward another year or two how many different conditions they add to readmission. I mean, as you know, it's really just heart failure, heart attack, and pneumonia. Rumor has it they're going to add orthopedics on there and a couple of other things, and we can rerun these experiments. So readmissions, it's a nice closed experiment. The data is pretty clean. It's pretty clear what the intervention needs to be, and so I think it's been helpful for the innovator community. And a lot of stuff has come out of readmission, and not a lot of it's been published because, of course, it's private companies working with private companies, and in competitive markets where healthcare providers compete with each other for patients, they're not incredibly crazy about publishing how they reduce their readmission for their competitors. But there's a lot going on in readmission. It would make a great case study for innovation in IT healthcare.
John, with Johnson & Johnson as the background, is medication adherence sort of another leading indicator of mobile health app success?
Yeah, I think obviously for Janssen Pharmaceuticals, medication adherence is a really important problem because we want to make sure that our patients are getting better and improving their lives through the medications they're taking. I think when you look at certain disease states, such as diabetes and HIV and oncology, the disease medication regimen is extremely complex, and medication adherence tools are very important. So I think for us at Janssen, not just at Janssen Healthcare Innovation, but the broader company, the whole company is really excited about the group that's building these tools, as well as because they really want to see any way that they can to help patients understand their disease state better, engage the right caregivers and doctors in the right way, and make progress moving forward.
So this came in from Twitter as a question for Doug. So Doug, your app is really, in a lot of ways, consumer-facing, but how do you get that to work sort of in an enterprise setting?
So we really pay attention. I mean, our customer is the provider. So the ROIs that we provide are really aimed towards providers. Now we look to drive patient engagement, of course, because that is important to us. That's our mission, is to make people healthier. But we always keep an eye on provider ROI, because in essence they are paying the bills, and that's why we make these things. So we think about a couple things. Readmission is one. Additional ancillary services after an admission, so whether that's physical therapy or cardiac rehab, which of course have reimbursement tied to them, and as well as helping people get ready for surgical procedures. So reducing the fallout rate on surgery day for outpatient surgery centers. And again, that's really an eye towards what is painful for providers. But of course, there's a great intersection with what's great for patients. Patients don't want to show up unprepared on surgery day. They don't want to forego physical therapy even though they've been prescribed it because they didn't know how to do it, etc. So we keep an eye on both, and not just one or the other.
Bianca, going back, I know this is unfair because it was just announced. It was just announced earlier this week, which is this sort of umbrella organization or legislation, Software Act, underneath the FDA. Have you had a chance to look at that at all? And is that something that will be helpful? It seems to me like it's a kind of bridge between the mobile health app world and the FDA, the strict requirements of sort of FDA approvals. Is that kind of what it's gearing up to be?
So I'm not that familiar with the Software Act myself, and it's just something I heard you guys kind of mention a little bit earlier. So unfortunately, I can't speak much to it.
So,
yeah.
Maybe but, Doug, is Doug? Are you more up to speed with what that's doing?
Well, I think it's an appropriate debate that we should have about what's the role of patient privacy, what's the role of data, what's the role of the economics of all of these things that we have to make our healthcare system work, and how are those things going to push and pull, and then how do we also foster innovation without fostering reckless stuff that's going to hurt people. So, I mean, I think it's a good debate to have, and it's been going on for a couple of years, and I think it's going to benefit everybody. It might be bumpy, you know, and maybe it's inconvenient for the innovator community, but I think it's ultimately going to be quite good.
And can I just add, I do think that privacy and security is a big concern, and as I kind of mentioned earlier offline, that Haptique is in that space of trying to kind of assure that privacy and security, and it's great that there's a company out there that's trying to do that. And it should be a constant conversation. But I think what is amazing is the number of people who are willing to volunteer their information if they think that it'll help them get them healthy. I think people are prioritizing their health over anything else at this point in time, at least those who are joining the app space. It's going to take a while until I think many people are comfortable with health IT in general, and it's been an ongoing issue for even electronic health records. But yet we seem to be very comfortable using online shopping sites and sharing our credit card information, which I would say actually tells you more about your health than anything else.
I'd love to jump on that one comment from Bianca in particular. You know, yeah. I think, like Doug said, the fact that they're having a conversation, hopefully a productive one in Congress, is a great departure from their behavior of late. So great, good for them on that. But I think one of the really critical aspects of the role of the FDA or legislation or any regulatory or legislative body of any sort is not to discourage or disallow people who are actively keen on sharing their data from doing so, right? I mean, so much of what's going to drive our healthcare system forward is the preponderance of data and our ability to make sense of all of that, and throttling down that pipeline because of some manufactured reason that the individuals don't actually think are an issue is something we've got to avoid. I
think one of the things that we do have to get to, though, on the consumer side is an almost de facto standard of opt-in as opposed to opt-out. And I know that there was a high-profile case earlier last week even that was announced, or maybe it was earlier this week, where an early-stage venture got into kind of hot water on that exact issue of patients requiring to opt out as opposed to opting in the first place. But that's a larger debate. One last question, and then I'll give everybody a chance to sort of close with closing thoughts. But last question for the panel: what is the role for crowdsourcing in the mobile health app space. Will that have a significant impact going forward? Anjana, we'll start with you.
I think so, and I think crowdsourcing has proven to be effective in a lot of ways. I think particularly on the back end side, when we're trying to understand some of these closed legacy IT systems, this is where I think crowdsourcing is going to be really important to get some of the best minds to make it open source. I think there's on the more patient-facing side, things like crowdfunding is still, in my opinion, a bit less vetted. So I'd like to see us focus our crowdsourcing efforts on just destroying some of these legacy systems for the better.
Speaking of healthcare, there goes one.
Yeah, I apologize.
Bianca, it sounds like it's fading out.
Yeah, it's either a combination of Obama passing by or someone going to the hospital. Just down the street from the White House.
Crowdsourcing?
So crowdsourcing, I think, in the way Anjana said, I think it can help break down legacy systems. I do think it could be a great way to get more innovation in the app space is through crowdsourcing by creating more open source code so that people can develop apps based on building off apps that already are existing to make better ones. And I think eventually, crowdsourcing could be used as a way to also evaluate apps by using the opinions of what people are seeing as what's working or not and helping us identify what's working.
Doug, crowdsourcing, crowdfunding?
I think there's a real, I mean, on the crowdfunding thing, I think Kickstarter is a great example of what they've done with hardware, and they can do something with software. That seems a natural evolution. But I think what's really interesting, and really to piggyback on what Bianca was going to say for a minute, which is I'd really like to see the very committed patient communities get involved in crowdsourcing design. And so if you have a group of innovators that are looking to make some sort of new application, let's say for breast cancer patients, to have different breast cancer societies have very, very engaged patients and have those patients input on design can be really helpful. So in terms of usability, what works, what doesn't, and things like that. So I think maybe crowdsourcing the design part can be really helpful too.
Which is a great lead-in to you, Stacy.
Yeah, so I'll say ditto to everything everyone else has said already, but I'll take one slightly different perspective on that, which is return to the conversation on data, right? I mean, I think, all of us seen enough of the news stories about people trying to, valiantly trying to extract their own data out of the system, the stuff that they ostensibly own but then can't get out of the systems. And I'd love for crowdsourcing of data to disintermediate the EMRs, right? Right now they're disincentivized to share because that data is actually valuable to them, and when they actually finally abide by the HL7 protocols and all that stuff, they're essentially going to become undifferentiated commodity databases, right? And they're trying valiantly to sort of keep that from happening, And so I would love for crowdsourcing to essentially create a groundswell effort to actually bring the data out, so that the people who actually, the entrepreneurs who actually can do something with it have something to play with.
Awesome. Well, listen, it looks like we're running, pretty close to the hour here, and I just want to give everybody one last chance to say any, sort of final closing thoughts. And again, we'll start with Anjana.
I mean, I think there's no debating that digital health is a really fantastic and cost-effective way to improve healthcare innovation. I think if we were to prioritize where we should be focusing our efforts, I think we should always be thinking about how do we improve patient outcomes. And I think at JHI, we believe that the way to do that is to understand that we need to take a very siloed, disconnected system and build a integrated care business and platform and pathway to understand how do we drive patient care from illness to health. So I think if we were to focus our energies on that, we should be focusing on improving the delivery of care.
Perfect. Bianca.
So I believe that there's a lot of promise in the medical app space. I do believe that doctors are going to start prescribing apps, especially if there are more reimbursement opportunities here. But we really need to generate more evidence and faster by creating new methodologies to evaluate these apps.
Doug?
I can't wait till we get to the point where we're not talking about mobile health or digital health or telemedicine. It's all just health. So I think we're getting there. I think we're very quickly getting there as the tools figure out a way to pay for them, as well as figure out a way to make them seamless in patient experiences. So I'm excited for that.
Jackie, we'll give you one last try here. I know we've had trouble with the audio, but if you can, is give us a closing thought.
Sure, thank you. Just to follow up on some of the FDA background I provided, I really encourage people with interest in the area to go onto the FDA mobile medical app guidance page. I think as time goes on and as innovators take the guidance and run with it in their own development, the FDA will be using that process to apply the guidance consistently and to provide the community with more with more information and even more clarity on how they approach these things. So certainly something to continue watching. Thanks.
Perfect. Stacy.
So I'll just wave this one flag one more time, which is, there's a pretty empty hole waiting to be filled by somebody to create a platform for innovation, right? To address all the issues that keep entrepreneurs from moving into this space. And whoever decides that they've got the courage to do it is likely to take on a pretty significant role in this space and probably make a lot of money too. So that's an invitation to somebody to do that.
Awesome. Well, listen, thanks everybody for participating in the Great Challenge program today, and welcome the chance to attend further Great Challenge programs, which are offered through TEDMED and obviously through the Robert Wood Johnson Foundation, which is the key sponsor. And again, we thank everybody for the attendance today.
Thank you for the opportunity.
Thank you.